My name is Onome Uwhuba. I'm a fourth year in the college and I'm a biological sciences major. And last summer I did the Human Rights Internship and I was in Nigeria for the summer. So the Human Rights Department of the University of Chicago offers a grant every year of $5,000 to college students and graduate students to also go abroad and do work relating to human rights. So I applied for the grant in the fall of 2011 and I received the grant to go do work for the summer. So I was in Ibadan, Nigeria, which is in the western part of Nigeria, and I was working at the University College Hospital in Ibadan, and I spent 8 weeks in Nigeria. I actually lived in a house. It's called the Healthy Life Foundation House. It's in the medical school campus, and so I lived in the house. Then I rented a room from the foundation owners. So I was working with the GOP, which is the General Operations Department of UCH, to create exposure programs, which are essentially internship programs. So when foreign students email the university and say they want to actually do an internship, I guess a specified formalized program that they actually do. So I was making the schedule of the programs, making the logistics, where they're going to stay, directions for them, security, things like that. So I was essentially interviewing clinicians in both the GOP department and various departments, like the A&E, the pediatrics department, as well as APIN. And APIN is an AIDS prevention initiative of Nigeria. And so looking at how students would come into the hospital and then walk in various departments and essentially get to learn different things. And so I made the schedule for that program, as well as did some research into legal rights for HIV positive patients in UCH. So it was like a multi-part internship. So making an internship, doing legal rights research, and actually making the logistics of the internship was what my summer was like. Most days most days we're doing interviews with clinicians and talking to doctors and seeing what learning experience they could offer in their clinics and what the different departments had to offer to students who were going to come in. And then I guess the last part of my internship was more doing research and actually compiling things together and making presentations and getting feedback and changing them again and making more presentations. So I guess the end, both phases were actually really dynamic. So there was never one really basic or general day. Yeah. I think the entire experience was really, really rewarding. I can't really think of any bad thing that happened in the experience. I think my most challenging aspect there was I had computer problems near the end when I was making presentations, and I had issues with actually my computer not working anymore, and so I luckily backed up all my information, so that was a good thing, but I think I had problems having my warranty ship the required things and just general issues with computers. That was my most challenging aspect. But the internship itself was really rewarding, so it was just more technological issues. So when I actually received the grant, I came to the Center for Global Health to talk to the staff here about any opportunities they were aware of in West Africa, and talk about logistics for where we're going to stay and and recommendations for institutions I could work with. And near the end, I actually spoke with the Dr. Olopades, both of them, and asked for recommendations for staff at UCH as well as other foundations in Nigeria I could get in contact with. And they actually helped me set up my resume to various colleagues of theirs in Nigeria, and they were really, really helpful with getting me up to speed with where to stay in Nigeria. Also getting me in contact with some doctors in University of Chicago Hospital here and talking about vaccinations and general healthcare stuff before you actually travel. So I think the CGH was really, really instrumental actually in me getting my position in the specific hospital I was in. I think the first thing is to really have a specific idea of what you want to do in the summer. So I knew what I wanted to gain from my summer experience, but I didn't know where I was going to go do it. So my problem was actually just finding an organization. But since I had a very specific focus of what I wanted to gain from the experience, it was a bit easier for me to actually find places. I wasn't really rigid about what I wanted to do, but more what I wanted to learn or gain from the experience. And so I think once you know what you want to gain, it's more about finding funding. And the University of Chicago has various opportunities for funding. There is the Summer Action Grants, the International Experience Grants, the Human Rights Program, and the Davis Peace Project. So various grants are out there. if you have really good work and a really good experience that you can actually justify to a grant given organization. So I think my best advice is to find an experience you want to do and then look for organizations, but the funding is out there. I think that should confirm my career goals. So I'm interested in working in Africa and working on entrepreneurship and health and the intersection between business and health, and kind of, because business first of all brings money, and money is access to health. And so just like working with the GOP department and also with APIN and talking with patients and clinicians, it really confirmed that I really wanted to do the work I was actually doing. And also I really like to travel, and this entire experience of traveling to a different place, and I really enjoyed the work I was doing, and it confirmed what I wanted to do. So I'm going to be going on to work in consulting actually, which isn't necessarily global health, but I think it's going to give me experience working in business, and I don't want to work in business in Africa. I think business and entrepreneurship are ways to approach development that haven't really been, I guess, considered. I think that business is a really good approach to global health because like business and entrepreneurship bring jobs and bring funds into the community, and they're often self-sustaining. And so I'm really interested in working in business and entrepreneurship in Africa, and so just like working with with GOP and with APIN and talking with the staff members, with the clinicians, and making internship programs and looking at how education and access to healthcare programs can affect how people change their career paths, and just their experience really confirmed my career goals for me. I worked really closely with the head of department for GOP and Dr. Arabo, and she was really, really helpful. I actually worked in her office, and so we worked really closely for the entire summer, and it was a really amazing experience to work with her and work closely with her and see how she worked. She was an inspiring doctor, and I really just enjoyed like working with her. Her and her assistant, for me, were the best summer companions I've ever had, and I think they basically made my experience really, really profound, and I learned a lot from them, and so I would like to thank them a lot. And also the Dr. Uwhuba days, because they got me in contact in the first place with UCH, and also helped me find housing in Ibadan, because I actually don't know anyone in Ibadan, so it was really helpful to get help from them for logistics, and just the experience was really, really amazing. And so Dr. Rabah and Fumi and the Uwhuba days are who I want to thank.